Ladies and gentlemen, Kenya is a strong leader in the information and communication, including technology space. We are the proud regional and continental hub of innovation. We have the appropriate policy framework, constitutionally protected freedoms of expression, media, information, and communication to dominate the creative art and entertainment arena. Our young people have consistently shown robust interest in this field and are engaged on various platforms, generating captivating content that is appreciated globally and regionally. There is tremendous potential for our country to become a global leader, employ hundreds of thousands of young people, and generate immense wealth if we facilitate the young people to plug into the global digital economy. To achieve these purposes, the government is committed to invest in the digital superhighway and the creative economy, which will be enablers of transformation, productivity, and overall competitiveness. Over the next 5 years, the government will ensure universal broadband availability through the rollout of connectivity throughout the country. The laying of an additional 100,000 kilometers of national fiber optic network is expected to deliver this target, and already we are in discussion with the players in that sector. Government services shall be made available throughout the country at greater convenience to citizens through digitization and automation of all critical government processes, with a view to bringing at least 80% of government services online. Moreover, to bring more Kenyans, especially the youth, online for business, learning, entertainment, and socialization, the government intends to take measures to bring down the cost of calls and data. This initiative converges with the efforts to boost the creative economy and scale up cultural production and the arts industry. Our government is also committed to the establishment of more art and culture infrastructure. The failure of a health system undermines prosperity. Kenyan families spend a total of 150 billion in out-of-pocket expenditure on health services a year, mobilized from various sources including Harambes, WhatsApp and M-Pesa groups, loans, sale of land and other assets to pay hospital bills for loved ones. Also, many small businesses fail when owners fall ill and cannot work, or divert money to pay medical expenses. It is no wonder, then, that it is commonly said that most families and individuals in Kenya are one illness away from poverty. 1 million Kenyans sink into poverty every year because of medical expenses. We want to lift, and we must, this punitive burden from the shoulders of Kenyans and their businesses through our universal healthcare plan. The plan is to revitalize primary healthcare by laying more emphasis on preventive and promotive strategies. Many critical health illnesses, including cancer, heart complications, kidney failure, and hypertension, can be detected and addressed at this level without the need for hospital visit or admission. Our health reform commitment is therefore threefold. In partnership with county governments, we will mainstream community health workers and make them the foundation of our health system. Reforming the National Health Insurance Fund is a necessary imperative. Progress has been made in enrolling more members, and in the last 10 years, 12 million Kenyans have joined the fund. The challenge, however, is that the NHIF is an occupational scheme that is tailored for salaried people on payroll in public and private sector, and not the social insurance scheme it ought to be. We shall change the contribution structure from an individual contributory scheme to a household contributory model. We intend to address the challenges of inadequate human resources in our public hospitals and the poor industrial relations between health professionals and our county governments. We are particularly committed to the professional development of our health workers, and I take this opportunity to assure our health workers across the board that we have listened to them and we will propose ways in collaboration with county governments of resolving all outstanding issues.